Hi, my name is Marcos Rosenbaum. I'm a licensed psychotherapist. I treat individuals, couples, families. Because I was born in Argentina, my first language is Spanish. And so I work with patients that speak Spanish, and also I have a good understanding of Portuguese. Part of the way that I work is I'm sensitive to diverse cultures, and always paying attention, particularly with couples, that sometimes one couple one is from one location in the world, from another, so there are cultural issues in between. So I'm very perceptive on that kind of issues. Almost always when I receive a phone call, it's because there is a life transition. Life transition represents choosing a career. Life transition represents getting married. Life transition represents when the children leave home, their marriages, their children, or our retirement. And on each time that we are dealing with this transition, we have memories of what happened in the past, sometimes sad memories, sometimes perhaps leading us to depression, feeling shame or guilt. And at the same time, when we are in this process of a life transition, we start thinking about what will happen in the future. Will I be able to accomplish that? That leads to anxieties and fears. And that's the kind of work I do here. We deal with depression, we deal with fears, we deal with sadness, we deal with shame. So about life changes, my personal life transformation, I spent many years doing research and as a doctor in physics and being professor in physics in different educational organizations. I decided to go back to school and to dedicate now the rest of my life, I hope, doing clinical work and doing social service. And I think this is a positive contribution that I can facilitate with my clients when they call me for their own life change. In my practice, I'm a psychodynamically oriented, but also I use the internal family model in which we focus essentially on those sensations that we have that act as protectors in our life that sometimes camouflage what we call exile, so traumatic experiences that we have. I also use EMDR and hypnosis, and I apply all these different approaches based on the different situations that happen here in the clinic, in the clinical work. For me, it's important when I receive a call from somebody to respond to the call as soon as I can. The decision for a person to search for therapy, I am very aware that it's an important decision. It's not an easy one to do. So I always am very aware that it's important for that person to hear from me in one way or another. So my goal in the therapeutic process with my clients is always very important to make sure that I hear them, what they want to achieve from coming to see me, and keep always in my mind that they accomplish, they get what they were looking for.